You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for patients with gum disease. No more bleeding gums, according to my first guest. With us, we have an expert on the topic, Dr. Milici. Dr. Milici, welcome to the program.
Hi, Randy. Thank you.
Now, before we get into today's topic, and I have a lot of questions about this because you have a lot of good news, you say.
Yes,
to offer.
absolutely.
Tell me a little bit about your practice. I mean, who's the typical patient? What are the different procedures you do? And I guess you work with your husband.
I do. It's a unique situation. I work with my husband, Frank Matarazzo, and we treat all sorts of patients. We don't really have a typical patient. We see patients that require all sorts of dentistry.
Now, you're a specialist, both
Yes,
of you. Is that
yes.
right? Periodontist
And prosthodontist.
and prosthodontist.
Yes.
But you do, I mean, like fillings? You do everything?
We do cosmetic fillings, we do general dentistry, we treat adult orthodontics with Invisalign.
All right.
We take care of gummy smiles. For a patient who shows too much gum when they're smiling, we can trim back the gum tissue.
You laser that off?
We laser that off.
So you do porcelain veneers?
Absolutely.
All of those things. So let's talk a little bit about your background and training. You're a periodontist, right? And also a prosthetist. So what is a periodontist? You're a specialist.
Yes, I'm a specialist. So I basically treat gum disease, all sorts of gum disease. And through my training, also having a background in prosthodontics, I have more of an insight of how the restoration will look after the gums are taken care of.
Okay, so I get this right. Now, normally a periodontist just takes care of the gums, maybe does some implant surgery, and they send out to a general dentist to make the teeth look good, to put the crowns on, right?
That's correct. That's what's
your
normally
training
done.
is both. Do I have that right?
Yes, and what's unique
Is that,
about
that is unique, right?
Yes, it's very unique, and that's what's so nice about working with my husband is that we tend to take care of these cases together.
So let's begin with defining gum disease. What is it? What are the symptoms, I should say? How does somebody know watching this that they have gum disease? Maybe their partner has gum disease.
Well, if they were to smile in the mirror and they saw, red puffy gums or swollen gums.
Puffy.
Yes, gum tissue should be a nice light pink color around the tooth, firm. When
But if it's puffy, what's going on?
Well, there's lots of bacteria underneath the gum tissue that's causing inflammation.
Okay.
And that inflammation will also cause bleeding. So if they're flossing their teeth or brushing their teeth, they'll get bleeding on the floss. They may
A little bit of blood is okay?
Well, no, gum should not bleed at all.
Really?
So no bleeding is healthy. They also may have a bad taste in their mouth. So they may, taste the bacteria, the dead bacteria that's living under the gum tissue and think that gargling with Listerine or a mouthwash is going to help when it really won't.
But the bleeding part, help me understand, why is that gum disease?
When you have bleeding gums, Randy, it's really a wound. It's a cut in your mouth. So bacteria is traveling throughout your bloodstream. So all that bacteria that's underneath the gum tissue that you're not removing by proper hygiene or by having healthy gums is affecting your body.
Okay, so the laser, but how does the laser stop that bleeding? That's the part I'm not getting.
Well, the laser is actually killing the bacteria that's causing the bleeding.
Interesting.
So just by using the laser around the mouth in a couple of visits, we can start to heal disease.
Okay, so puffy gums we talk about, that's gum disease. So if you
Yes.
have red puffy gums, bleeding gums,
Bleeding
that's another.
gums.
What's another symptom of gum disease?
Well, another type of gum disease is gum recession, where the gum tissue is receding away from the crown of the tooth. So, and that could be caused from overzealous brushing or from grinding and clenching. So that's another type of disease.
If people do nothing with those receding gums, okay, what happens?
They're losing not only gum tissue, but they're losing the bone that supports the tooth. So ultimately, tooth loss will occur.
Okay, so people with puffy gums, red gums, bleeding gums, all of these things, what's the treatment options? What have they been? And then what are the new breakthroughs?
Well, previously, gum disease was treated in phases with, let's say, starting with scaling and root planing to try to get some initial healing. And then if the disease was not arrested, we would do surgery. We'd cut the gums, pull the gums
Like cutting
back,
it out, cutting this
like
infection out.
Cutting the disease out. But what we would leave was exposed roots. So patients would have long teeth, sensitive teeth now. So now, instead of doing that, we're using the laser.
And your job as a specialist, though, and I want to get this right, that when somebody comes to you with gum disease, that's a surgical procedure.
Yes.
Okay. Very painful as well?
Traditionally?
Traditional.
Oh, traditional surgery. Well, during the procedure, no, because the patient's numb, but post-operatively, it is very uncomfortable, and patients are left with sensitive roots.
So when you first started using the laser, okay, used to surgery, now you're doing the laser, what were your initial results?
Well, initially, Randy, I was very skeptical, but through all of my training with the laser, I really believed in it. And so after I did my first set of patients, I would go back in and probe, and I would have, very deep probings, 9, 10 millimeters, shrink down to a 2 and a 3.
What does that mean, by the way? I don't know what that means.
Well, a probe measures the depth of the periodontal pocket around the tooth. So the deeper the probing, the less healthy the tooth is, or the gums are.
Okay.
And so normally, 2s and 3s are considered very healthy. Well, I'm seeing patients that are probing 6s, 7s, 10s.
Okay, so these are pockets. Okay, so the gums, when you have gum disease, you get these spaces in and around the gums.
Yes, caused by bacteria.
And they're pockets.
In their pockets.
And these 8 millimeter or whatever, that these are normally had to be taken care of with surgery.
That's correct.
And then the gums get close to the teeth again. Is that
Yes.
right? So the laser does what then?
Well, the laser goes down underneath the pocket, or into the pocket. It's ablating the bacteria. It's killing the bacteria that are living not only on the root surface, but also in the lining of the tissue, as well as the top layers of the bone. And that's really the beauty of the laser. It's killing bacteria that are living in these privileged sites that we can't get to through normal periodontal therapy, like scaling and root planing, or typical gum surgery, bone surgery.
If it's as good as you say it is, why aren't all doctors using a laser to do this? Is it the expense of the laser? Is it they don't believe it? What is it?
I think there's some of it that is the expense, and there's some that we just really, periodontists in general, like to cut. It's hard to change old habits. They've been cutting for years, and it's hard to learn a new technique and to really put the time and energy into learning more about the laser.
But this is about overall health as well. I mean, this is a chronic infection in the mouth.
Yes,
right?
yes.
Laser kills that chronic infection. It's got to be good.
It's wonderful. It's amazing.
And you say you give your patients, and I want to quote you, laser love.
Yes, yes.
What does that mean?
Well, the laser, I use the laser for different things as well. Not only do I treat periodontal disease, but I use the laser to treat muscular problems caused by temporomandibular joint problems. So I had a young woman, just last week who called me up in excruciating pain, and she felt that she couldn't go to work the next day, and she was not sleeping.
Like what kind of pain? I mean, pain from
Well,
what?
pain from her jaw. She grinds her teeth and clenches her teeth. And so she forgot to wear her night guard for 2 nights because she was away. And so anyways, I said, well, why don't you come in at the end of the day, which she did. I treated her with a little laser love. And the next day, she called and she told my assistant that she felt 1,000,000 times better and could not thank me enough.
Okay. Yeah. Now, let's talk a little bit about, because you've made statements to me on the telephone, like we're changing people's lives. How so?
So I have a patient that came in. He was ashamed of his smile. He had bleeding gums, puffy gums. His teeth were starting to shift because of the disease. He also had some crowded teeth that he couldn't clean well, and that was making the disease worse.
Okay.
So when we looked at his mouth, we could see that the bacteria had caused bone loss. So by treating him with a laser, we were able to tighten up the gum tissue, kill all that bacteria, tighten up the gum tissue, so now it's a nice light pink color. Now when he brushes and flosses, he's not bleeding. He doesn't have bad breath anymore. Now he wanted to take care of his crowded teeth. So we're just finishing up with Invisalign, and he's a remarkable patient. He's already asking me what we can do next after the Invisalign. We're going to either bleach his teeth or do veneers or a combination of both.
So people with bad gums, that they just say, I have bad gums. So I can't get veneers or I can't get dental implants. You're saying, though, that this infection, the laser will go in, target. How does it work, by the way? How does it kill gum disease? Is it the heat? What is it?
Well, it's the laser energy. It's actually the wavelength of the laser beam that's killing the bacteria. This laser, this particular wavelength of the laser that I'm using, is attracted to dark pigmented bacteria, the type of bacteria that cause gum disease. So the laser gets underneath into the pocket and kills the bacteria that are causing this disease. So I have another patient, a woman in her early 50s who came in with puffy gums, all bacteria underneath the gum tissue, hardened tartar buildup underneath the gum tissue. And she thought that I couldn't take care of her. She said, I want to save my teeth. but I don't know how you're going to be able to do this. And I said, with the laser, we can definitely accomplish that. And so I treated her very successfully. Her gum tissue healed up beautifully. We were now able to save her teeth.
So her options, had she walked into another periodontist possibly, they would have had to cut or do surgery?
They would have had
Is that true?
cut, yes, absolutely. They would have had to cut her gum tissue away. They were so inflamed.
But going into this, periodontist friend of mine, and I say this respectfully, he says, but Randy, traditional therapy works. Traditional surgery, cutting out the disease, works. What is your response to that?
Well, it does work. We've been doing it for years and very successfully. The problem is that if we cut out the gum tissue, we're still leaving behind lots of bacteria that are living inside the walls of the gum tissue.
Okay.
So we're
Could
not,
anybody disagree with that? What you
no,
just said?
nobody could disagree with that.
Okay.
So it comes back. We never really cure periodontal disease. We're just trying to get it under control. So with traditional surgery, if we cut it out, we're still leaving lots of bacteria behind that continue to cause the disease. It can get into the bloodstream. With the laser, we're zapping all of that bacteria and to allow the patient's own body to heal. So they both work. I just think that one works better.
Is there any science behind what you're saying, by the way?
Absolutely. There's all sorts of histological...
I mean, published literature?
Yes, showing that we're not only growing bone, but getting new attachment.
Okay, so you make so you're killing the chronic infection.
Yeah.
I mean, logically, this makes sense to me. How could your colleagues not agree with this? And I'm not trying to side with you, but if what you're saying is true, it seems like a logical thing to do, to go in, look for a laser dentist. Do you call
Absolutely,
yourself
yes.
like, is it laser dentistry?
Yes, laser dentistry.
Do you use a laser for anything else, by the way, that we haven't mentioned?
Well, I use it for cutting, for sculpting gum tissue.
Okay.
And I also use it for my laser love when I'm treating some temporomandibular joint problems.
So is it more women than men that are coming in?
Well, usually the women will come in first. Men are usually, they wait too long because they're afraid to come in. Their wives are dragging them in.
Is that right?
Yes, absolutely.
Like why? Why would the...
Well, they know that their husband has bleeding gums. They know that they have bad breath. And they also are afraid that they're transferring the bacteria back and forth.
Is that possible, though?
Yes.
Is that a valid worry?
It absolutely is. Periodontal disease is contagious. So by kissing, you can contaminate your partner.
So if you have a bloody mouth, obviously, inside,
Yeah.
that is going to be transferred.
Well, the
Interesting.
bacteria is going to be transferred to your significant other.
What motivates people the most to get this done? Because people don't want to go to the dentist. They have bleeding gums, puffy gums. And just to make it clear, you're saying they're headed for tooth loss. I mean, that's the number
Yes.
one reason why people lose their teeth is gum disease.
That's correct.
And I don't want to put words in your mouth, but it sounds like it's a pretty easy fix if caught early.
If caught
bleeding
early.
gums, puffy gums, you go in there with a laser, kills this chronic infection, the gum gets better, the teeth get stronger.
Yes.
That's not, do I have it
It's
right?
easy. If you treat it early, it's very, very easy. If you wait too long, we can't save all teeth. If you wait too long, there's going to be more bone loss and more of a risk of losing those teeth. But if treated early, we can certainly save a lot of teeth.
But the main thing is it's more than teeth. I mean, like you told me on the phone, it's about a smile that you've always wanted. How important is this smile in your opinion?
Well, you know, a smile is how you present yourself to the world. So I have another story. One of my husband's patients, who's a sports newscaster,
Okay.
never smiled on the camera, and he was very self-conscious about his teeth. So my husband did a reconstruction of his teeth and remade his smile, and now he can't stop smiling. He's
So you see people smiling more
oh,
because of it?
oh yeah, yeah. They're not covering their mouth while they're speaking. They're not looking away. They're feeling healthier and stronger, physically even. They feel better. They come in saying that they feel better, healthier.